I'd like to talk a little bit about some of the unusual uncertainty facing the oncology community. The field of cancer research and treatment is almost by definition continually evolving. Now, that progress has come with uncertainties and over time irregular leaps of progress. We've also lived through periods of disappointment and stagnation where the standard of care doesn't change right up to the point when it leaps ahead with innovative discoveries and survival benefits based on remarkably creative and effective new diagnostics or treatments. And for those of us who've been in the field for decades, this cycle of exhilaration or despair is common and manageable. But recent months have raised even further uncertainty about how progress in oncology will continue. With little asked in return, the National Institutes of Health and the National Cancer Institute funding has propelled scientific and clinical advances and collaborations within and across academic institutions and led to translation in the pharmaceutical field and cooperative group clinical trial success. This flow of information and development of therapies with production of innovations has crossed national and international boundaries and led to a community of oncology that has provided the world with unprecedented clinical benefits and scientific advancements. However, now it's unclear where the scientific leadership in the U.S. and our biomedical research pipeline will be derived, as well as funding mechanisms in the world's best scientific peer review process, which are currently being evaluated and in some ways left with an uncertainty in their process. The uncertainty of the process and funding streams not only impacts the current discoveries in progress, but also shakes the fortitude of the investigators, those people staking their careers and personal commitment on what is increasingly an uncertain future, where funding support to run a laboratory or a trial, federal funding for new therapies, and particularly for populations for whom Medicare and Medicaid is designated, this is in question. Now, millions of individuals have sacrificed to contribute to this oncology enterprise, with the physicians, the staff, the nurses, and the patients, in the ability to develop new knowledge or to be caring and a skilled professional who delivers oncology care, whether in a community or academic setting, is now at an unprecedented level of uncertainty and risk. The latter is so much of a concern because it takes at least 10 years of education and training to help replenish the pipeline of those retiring or leaving the field. This could create a gap that's difficult to overcome. If the bright and amazing young individuals in their amazing training and commitment does not have the commitment, it does not have a demonstrated level of security and sufficient reassurance that they maintain their commitment and their presence in the field, and they move their professional careers elsewhere outside of oncology. And so I believe time is short. These individuals are making decisions, weighing what to do with their careers and how to apply themselves. Hopefully, as a society and as a government, we will maintain the crown jewel of the U.S. biomedical community via the NIH and the NCI, even when we have budgetary challenges and deficits that are well recognized. And this poses an existential dilemma for our country. However, productivity and lifespans have been prolonged and restored, leading to increases in productivity and tax receipts and paying back into the system through the health and well-being of our community and our citizenry. We should not lose sight of how we got here, more than 50 years after the National Cancer Act, and we should recognize and reflect on the amazing progress that this societal investment has produced around the world. Hopefully, our leaders in the executive and congressional branches of the federal and state governments have as broad a perspective as possible, understand the risks that uncertainty presents, and are able to help us continue this commitment and investment, which has paid off so handsomely for our society.